Hello, everybody. Good morning and afternoon. Thank you for joining us in our weekly It's Worth a Shot series. Today we have a well-packed 30 minutes where we have a guest speaker that's going to be presenting on age-friendly health systems. So stay tuned for some amazing information that she will be sharing. Mary, next slide, please. This has a standard statement here. Our presentations may contain information or content that's supplied by third parties. Any information provided does not constitute endorsement or recommendations by Mount Pacific. Next slide, please. As we all know, we are seeing a lot more challenges with behavioral health in our communities. This is a section that you must watch or must see. It's an overview of bipolar disorders for nursing facility staff. So it's a great, the registration link is there. We'll also place it in the chat. This is coming up on March 26th, 2 p.m. Eastern Standard Time. So it's a great opportunity for participants to learn appropriate responses of engagement with residents. So next slide, please. And just some housekeeping items. We always love to hear your comments and the evaluation that we post at the end of the session, and sharing webinar topics or ideas that you would like us to present at It's Worth a Shot, as we are moving, in these topics beyond COVID. And so if you have some great ideas and you want to include that, just drop it in the chat or complete it on the evaluation. Next slide, please.
We do have 3 polling questions coming up.
Sorry, I missed that.
Not a problem.
Here's our first polling question. Have you implemented a consistent process and policies for de-prescribing of medications in your facility? Take a few minutes and respond. Have you implemented a consistent process and policies for de-prescribing medications in your facility? Okay. And it's kind of breaking in between sometimes and never. About 50% are saying I'm sure. Let's go to we go to the next polling question there.
They just have to scroll down.
I see.
3 polling questions.
Okay, sorry about that. Thank you. Do you provide de-prescribing practice trainings to your staff on an ongoing basis? You hire annually as needed or not? And the last question is, do you provide de-prescribing resources, information to your residents and caregivers? Questions there, the results coming in slowly. Okay. I don't see any more coming in. We can go ahead and share the results. Thank you all for participating in those polling questions. So more to come. Next slide, Mary. All right, here's our weekly influenza snapshot. So green through our area, Alaska, Hawaii, Montana, low numbers there. So again, influenza season pretty much comes up, they say comes up to the end in March. But always want to make sure we're washing hands and wearing masks if necessary to stop spreads. Next slide, please. And this is our weekly COVID snapshot. Again, lots of different colors there, but substantial decreases we're seeing across our region. Although you see some pockets there in Alaska and Montana where there are some increases. So trending though, we're seeing a decrease. And so that's good. And we decrease in hospital admissions as well. Next slide, please. All right, so I want to introduce you to Amanda Beyer. She's a project manager for the Age-Friendly Health Systems. We also have Alice Bonner, Senior Advisor for Aging Institute for Healthcare Improvement, also known as IHI. And Amanda, if I could turn the mic over to you and you could share all the great things about the Age-Friendly Health System.
Thank you so much. I appreciate the invitation here today, and it's lovely to meet all of you in this online, on the phone sort of way. As Marcy mentioned, I'm Amanda. I work at the Institute for Healthcare Improvement with Age-Friendly Health Systems, which is what we'll talk about today, specifically in regards to nursing homes and how this movement can benefit nursing homes and how you all can join in the movement as well. I really appreciate the opportunity to speak to Mountain Pacific Quality Health Foundation's nursing home cohort or group. I'm originally born and raised in Montana, and so I've worked with Mountain Pacific when I used to work in nursing homes as a social worker and discharge planner. So it's cool full circle moment, and you can go ahead to the next slide. The mission of Age-Friendly Health Systems specifically, it's a movement. It's not really a program. It's a framework and a nationwide and now a global movement. We're working to help all care for older adults be age-friendly, and we'll talk about what that means. But right now, about 700 nursing homes across the US are recognized as age-friendly, and we have different settings in Ireland and Qatar and Australia that are joining the movement as well. And so we're truly looking at this as a global kind of effort and hoping that wherever an older adult goes, whether it's to see their primary care doctor or have a rehabilitation stay or be in the hospital, that we can all kind of rally around this framework and start speaking in similar language and approach care for older adults in this evidence-based way that's guided by the essential set of practices that we refer to as the 4 M's. When we use this framework, it causes no harm and is consistent with what matters to not only the older adult, their family, their caregivers, their loved ones, whoever the people are in their lives that they name or are involved in their day-to-day care. Next slide. The 4 M's themselves, you saw one of them actually on the previous slide, and the one that I argue over kind of overviews and umbrellas all of the rest is what matters. The other 3 are mobility, medication, and mentation. We believe from 20 different evidence-based frameworks that went into designing the 4 M's that these represent the core health issues for older adults. This again builds on all of those evidence-based models that were distilled down to the 4 M's. And the reason being that this care doesn't seem to be very consistent. Many different places are using different models and different approaches, but not very consistently and reliably. And that's what we believe and have seen success with the 4 M's using the framework to provide care on a more consistent basis. It actually, in the end, ends up simplifying and reducing the time and effort it takes to provide consistent care, consistent improved care to older adults. And you'll find that once you start, they all sort of interweave and affect each other. Next slide. These are actually, there's a slide like this for every setting. Age-Friendly Health Systems began in about 2017 with the distilling down of those 20 evidence-based models. And the first place that we piloted those were in hospitals. And once we kind of piloted and figured out what the 4 M's looked like in that setting, we moved on to the ambulatory setting. And then in 2020, we piloted in nursing homes, and there were 5 pilot nursing homes. And from that, each setting has their own sort of how you assess and how you act on. Keeping in mind that these are not hard and fast rules. The goal is to just make sure we are assessing and acting on. And it's interesting that those poll questions in the beginning were around deprescribing, because that's a lot of what the medication M is around, and helping to sort of design very consistent systems for both assessing that and then acting on it as well. So these are some of the things that can happen in each of those steps in a nursing home. but we recognize that it's also very unique and based on locality and even company and nursing home to nursing home. And that's what's great about the 4Ms framework, is that it really can be modified and sort of molded into what works for your facility. Next slide. We have a lot of resources on IHI's website, and if you get on it, sometimes it can be a little bit overwhelming when you're trying to figure out what it is that you need to get started. And I would direct you right to this. This is the guide for care of older adults in nursing homes from the 4Ms and the age-friendly perspective. This really takes you from beginning to end, understanding the 4Ms, and then how to start in your facility, how to start looking at your current care processes, how to look at and find gaps, and how to start running some PDSA, some plan, do, study, act improvement cycles to try to close some of those gaps and find what works for your facility. This guide will help explain the process in language that staff can get behind, helps you communicate up to residents. We really believe that communicating with staff of all levels, all residents, patients, and anybody that's involved in their care is very important in age-friendly care. And also how to communicate to your community about it. You know, how to start talking with your discharge planners at the hospital. They might be recognized as age-friendly and starting to use the 4Ms, and we really are starting to see how that can work across care transitions to improve the outcomes when older adults are changing settings. So this is where you would start. All of the settings have a nursing or a workbook that helps them get started. But if you go to the next slide, we have a workbook that's only for nursing homes. None of the other settings have this. This came out of that work that I was telling you about earlier with the 5 prototype nursing homes. We found out very quickly, which isn't going to be a surprise to all of you, that there's not a lot of consistency across the country around the electronic medical record a nursing home uses, if they use one at all, that there's still some facilities out there using pen and paper. And so workflows, adjusting workflows, trying new things can be very different from facility to facility. And so this workbook was created in recognition of that, to try to give a little bit more, a little bit higher step for a nursing home to be able to pull out some worksheets and so that you can print and use within your paper medical record if needed. Just a little extra help to get people over that hump. So we can go to the next slide. What I'll be talking to you today about is the action community, and there's a number of ways that you can join the age-friendly health systems movement. This is the most popular way to do it. Most people come through an action community, whether it's through IHI or it's through the American Hospital Association. There's even some states that run their own action communities. But really, these are about peer support, and then also support from expert faculty in a variety of specialties. We have expert faculty in all 4Ms, and so we have someone for mentation and medication, so forth and so on. And then we also have experts that are based on the setting. And so in IHI's action community, we have nursing home experts. We have Joanne Reifsnyder, who used to be the CEO of Genesis and has worked in nursing homes forever, and Alice Bonner, who was not able to be here today, but is our senior advisor on aging and has also been working on with and for nursing homes for her entire career. And we have that sort of peer and expert support to try to help people get through the process in a very, very clear step-by-step manner. Within the action community, you register, and it's 7 months long, and it's completely virtual, and it's 100% free of charge. We meet time commitment wise about 1 to 2 times per month. Usually we have a group webinar where all the hospitals, ambulatory settings, nursing homes all come, and we can do a deep dive on one of the M's so that we really get a firm understanding of it. And then we talk quality improvement and how for that specific M, we might start making some changes and adjustments to improve things. And then we also have peer coaching calls, which are led by myself for the nursing home and Alice and Joanne. Each setting comes together 5 times throughout the action community. We spend an hour together really just making connections between nursing homes in this case. You'll meet your peers, you'll get to hear case studies about how how successful facilities have implemented age-friendly. We definitely talk about barriers and how we might overcome them, and really make those connections across nursing homes themselves. So it's a very fun, positive way to spend some time over 7 months. It's not a huge online time commitment. There is time commitment, of course, during action periods when you're working with your teams in your nursing homes. But by the end, we hope that you can fill out your plan for how you provide the 4Ms, which is how you get recognized. And I'll talk a little bit more about that. Go ahead and go to the next slide. So there's a lot of reasons, and I think I've underpinned some of them about why a nursing home might want to go on this journey. And of course, the number one is the improved care for older adults using something that's very consistent and organized and based on the evidence. I have no doubt that all of you are already providing many aspects of 4M's age-friendly care. In fact, I firmly believe that nursing homes are in the best position to become recognized just because of how they're structured already. You are all doing MDS assessments. You're already assessing for different cognitive and mentation things and mobility, depression. You're doing that on a consistent, regular basis. So you've already got a big head start. And a nursing home is also already organized as an interdisciplinary team. And that IDT team is really what's key to pushing age-friendly and the 4Ms forward. And so what we find is a lot of nursing homes look at the material and they think, wow, I'm almost there already. There's only maybe a few things, but pretty influential things that they can do to improve and move to that next step. To get recognized, that would be the next benefit of joining. I want to be really clear that recognition at level 1 comes with a plan. It doesn't mean that you've actually changed or done anything yet. It means you've gone through the 4Ms, looked at how you're assessing and acting on, and made a plan for how you're going to do it moving forward and what the improvements are going to be. So once you've submitted that plan, it's in a care description, we call it. IHI will work with you if there needs to be some adjustments somewhere along the line, and then you will get recognized and your name will be on the website and you will get a kind of a media packet for how you can promote that in your local community. You can use the logos in your emails, any kind of marketing or discharge planning that's being done. You can use those to communicate with the community, the great work that you've done and what you're doing moving forward. And lastly, what we're finding in nursing homes, and we hope to look at a lot more in the next 3 years of this grant, is that with consistent implementation over time, we're seeing positive changes in outcome measures. Things like falls, although mobility is not 100% focused on falls, staff satisfaction, resident satisfaction scores. Particularly with nursing home staff, there seems to be something kind of cool that happens with the camaraderie and the positiveness and the speaking of the same language when a nursing home starts working with the 4Ms. That really just is something really beautiful and positive. So I want to make sure that I communicate that, and something that we just found out this week through a blog post by one of the VA's nursing homes that became recognized last year. They decided to take the 4Ms and use it as the organizing framework for their stand-up meetings, which, as we all know, can get very long and complex, and sometimes we don't get to cover everything we want to cover. And they were doing those twice a week, and it was taking 4 hours each day. And after some consistent implementation of using the 4Ms to guide their discussion on the residents, they got that down to 2 hours total. So as I said in the beginning, it can really save some time just with the way that we're talking to each other. So next slide. This is a great quote from one of the nursing homes that was recognized somewhat recently about, you'll see there, the transformational impact that the 4Ms had on their SNF, and some of the outcomes there at the end that they found were positive. Fewer falls, reduced prescribing of inappropriate medications and behaviors, and increased documentation of what matters. Next slide. I'll send these out, or if you guys are going to send the slides out, these links will be live. These are the 5 prototyping nursing homes that implemented the forums very first. And they have a lot to say about how that went and how they got over some of the challenges and some of the good things that happened as a result. And next slide. That's my email address. I'll put it in the chat as well. I do want to say, if the action community isn't for you because you don't want to do a 7-month online scenario and you're still wanting to talk about age friendly or join the movement another way, there's definitely a do-it-yourself pathway. The link I just put in goes to the Join the Movement page, and you can read more about looking at the care description and some of those nursing home specific resources. And if you're feeling like you can fill it out and submit the plan without coming through the action community, then you are more than welcome to do it that way and become recognized a little bit of a different way. We're always here either way for one-on-one meetings or questions or whatever help we can provide. And I will let it go and open it up for questions.
Thank you, Amanda. If anybody wants to come off of mute and ask any questions or put any in chat.
There is one question in the chat for Amanda. Is there a deadline to sign up for the action community?
We'll be taking registrations all the way through April. The kickoff call is actually next week on the 13th. But it's no big deal if you don't sign up by then. It'll be recorded, and really anytime in that first 6 weeks, it's pretty much okay to register and get started at that point. You won't fall behind. And even if you sign up and you start coming and are like, I can do this, I can fill out this care description and get recognized. There's no commitment that you have to stay for the whole thing and come to every webinar just because you registered. It's very flexible.
Any other questions for listeners?
Okay, if we don't have any more questions, then we can go to the next slide. Give you guys a couple minutes back early today. We do have our evaluation in the chat, so if you will fill that out, we really appreciate it. Any topics you may want covered or any comments, please do fill that out and let us know. And next week, March 13th, we have our Dr. K, who is going to be presenting on colorectal cancer, as it is colon cancer month. I don't know how that's worded. Somebody help me out here. National Colorectal Cancer Month. Every day has a day for some reason now, but anyways, that's the topic we'll be covering next Wednesday, and we hope to see you all then. Thank you for Amanda for your presentation, and thank you all for taking your time to attend with us today.
Thank you all. Have a great day.